Welcome to today's COVID-19 update. We are speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you once again for having me in the program.
All right, Minister, just a quick update on Region 5. I know the team is heading in there and everything basically is set for when they arrive.
Well, as you know, we have found a number of cases in Maracaibo, and the regional health team has placed a lot of attention in that area. We have had some challenges with the village and the Tushawan Village Council in terms of communicating to the rest of the residents in the area. And hopefully these matters now can be resolved, because it is a health concern, a public health concern in the community. And when you have so many persons in a small concentrated area being tested positive, it means that it can affect the health of the others. So we have another team that is going in today, and they will be spending some extended time in Region 5. We are hoping that we'll be able to test more people, and once we do those tests, we'll be able to get a better sense of how many people are infected with COVID-19 in Maracaibo. I want to appeal to the residents of Maracaibo to assist us, because it's really our health team is there to help them to prevent the spread of the disease and to assist them in getting better if they're infected. And we also want to monitor, because in terms of the severity of the disease, there might be a few persons who can get the disease in its most severe form, and they would require hospitalization. So before those things happen, we want to ensure that we're able to pick them up early, and if necessary, if we have to move them and get them out to be hospitalized, that we do that in a timely manner. So for us to be able to do all of these things, we require the collaboration, the cooperation of the key people who have influence in the community, as well as the residents generally, to assist us in making sure that we are able to provide this service. So hopefully, now that I think persons know that there are so many cases there, that they'll be more willing for us to assist and for us to have this collaboration.
So you've been emphasizing and re-emphasizing the need to work with the community. And aside from that, the team itself is not new to this. How confident, and confident is such a minor word when it comes to, because you understand, your team understands what they're tasked with. But just for the sake of those that are listening, tell us a little bit of how the team prepares when they go in.
Well, the team, I mean, we have persons who understand infectious diseases. They understand COVID. They've been working with COVID patients for the last several months, so they understand the dynamics of the disease. We have trained them to do PCR testing, so they understand how to take off the swabs. We have trained them in terms of doing antigen testing, so they know how to do that. So this is a very experienced team, and I'm sure once we have that cooperation, we'll be able to effectively test quite a lot of people. But it comes back to people coming forward wanting to get tested, because if they were exposed to someone who had COVID-19, then they ought to come and let us test them. I think sometimes because there might be people who are positive and asymptomatic, that people believe or disbelieve the results. But as you know, that there would be a large amount of persons who can be asymptomatic. That does not mean they're not carrying the infection, and they can infect others. And if you have persons who would have a higher risk because of comorbidity or because of age, then those persons can have a more severe form of the disease, which in some cases can result ultimately in their death. So we want people to understand this, because while most people would have a milder form of the disease, there are a smaller group of people who would be at increased risk and who can get a more fatal form. And we just want people to be safe. So if we can get the cooperation to be able to provide this service, then we can protect those persons who might be at increased risk.
All right, thank you, Minister. As we're on the regions specifically, last time we spoke, you were focused, the ministry was focused rather on Region 7 and so on. I haven't had a chance to ask you that, but how is it going in Region 7?
Well, in all the regions we do have cases, and they fluctuate. So you have peaks, and then we control that, and then we have a decline, and then sometimes we see things going up again. And similarly, that's what we are seeing in the interior area. So we have seen some spikes because we have ramped up testing, especially around the dormitories and so forth, as students were coming back. And we have seen cases, not just in students, but in terms of teachers and other staff at these facilities. And therefore, it shows that you still have some amount of COVID transmission within the community. And that's why it's important that you take precautions. So right across Guyana, we have seen cases, and while we have seen a drop in the numbers, it does not mean that we don't have transmission occurring. We have transmission occurring all over in every region. So we have to get people to understand that the only way we are going to break transmission is that we have to adhere to the measures that we've been speaking about.
All right, and as we're on regions as well, I know one of the things that you've been focused on was developing the regional ICUs. How has that been going so far?
Regional hospitals generally, we have added, we have given them additional equipment such as ventilators and oxygen concentrators and other things that they would need. We have provided them with the right amount of PPEs and so forth. So this is an ongoing effort to equip them so that if they have persons who need hospitalization, that they would be able to take care of those patients. So in all of our regional hospitals now, we have provided the right types of equipment to allow for the management of COVID-19 patients. As you know, one of the major symptoms of COVID-19 requiring hospitalization is shortness of breath. And we have to be able to provide those types of equipment to aid the person in breathing. So those can be CPAP and BPAP machines or ventilators. So we have been distributing these to our regional hospitals.
All right. As we're on COVID-19 patients, some statistics that the ministry has shows that men make up for the larger percentage of COVID-19 related deaths. I think it's 63 and women at about 36. Could you talk to us a little bit about that?
Well, the challenge that you have there is probably risk-taking. And we know generally that men sometimes don't pay attention to the proper use of masks or sanitizing and so forth. Maybe that can be a contributing factor. We haven't done really a study per se to determine what might be these factors, but generally we have seen men undertaking more risk-taking kind of behavior, so maybe that might be a contributor. The other thing too is that generally men don't come to clinics, and if they do have underlying conditions and it's not controlled, then that can be another factor that might contribute to their elevated risk in this instance. But as I said, we don't have any formal study, and all these might just be hypotheses that we can put together. But for us to get a proper understanding of why, we'll need to do more formal studies and to be able to come up with the right answers.
Okay. I wanted to talk to you a little bit about the COVID-19 vaccine. We're in 2021 and the campaign, the education campaign should begin very soon. What are some of the expectations?
We are working to ensure that Guyana would get a vaccine soon. As you know, we have established a national task force dealing with vaccine. We have started our preparedness for vaccine in terms of the documentation that is necessary. So we have prepared what is called a national vaccine preparedness plan, and that is the roadmap that we are using to roll out vaccines in Guyana. In terms of our readiness, we have to look at our existing vaccination centers and upgrade them. So last year's budget, we have been able to pass monies to do that, and we have started to expand some of the existing vaccination centers that we have. In addition to expanding the physical space, we also have to get new refrigerators and generators, and we have already put in orders to buy these things, and some of it is already on its way to Guyana. So once we get those freezers and refrigerators, we'll start installing them. We're hoping that we'll be at a better state of readiness by the end of the month, and once we get all the pieces coming together. So that's in terms of the physical establishment for vaccine and how we're going to roll out this cold chain. In addition to that, we have to train personnel to make sure that the people who would be doing the vaccination know what they're doing. Now, a lot of these people have experience with rolling out vaccines, and so we're taking staff that would have worked with vaccinations program before, both at the national level and at the regional level. But we are training them more specifically to deal with the types of COVID vaccines that we're expecting. Each one of the vaccine would have different types of requirement in how you put together the vaccine, the conditions under which you store it, the amounts that you have to pull up into the syringe, how you have to administer it, where you administer it, what to look for in terms of side effects, how long people will have to wait after you administer the vaccine. So all these things are things that we are training our staff to do. And because there have been some rare cases of adverse reactions, we also have to train our staff to recognize these adverse reactions. So that type of training with our staff is ongoing. We have prepared all the training material, the course that they have to complete. And of course, while we do that type of clinical things, we also have to do proper recording of who is getting the vaccine, when they got it, which batch they got it from, the dose and everything, and then when to come back. And persons would be given vaccine cards and so all this type of training we have been working on, and we have started that process of identifying people and rolling out the kinds of training. So that's another set of work that we have been doing. And then of course we have been working with the different agencies like COVAX to get vaccines into Guyana, because they're going to help us to source the vaccine. So we have been in communication with them, and hopefully when we get those vaccines on our end here, we'll be ready to roll that out. So it's a lot of work that one would have to go through, but nevertheless, it is work that is absolutely essential that we go through, so that our staff is fully aware about what they need to do, how they need to do it, and to be able to do that very effectively.
I know this is a huge campaign. I also know that legislative-wise that you have brought a motion to the Parliament to deal with this, and Not asking why it's necessary, but what are some of the key points that you would like people to know?
Well, the key thing is we need to have as much people vaccinated as possible. Um, and since these vaccines are primarily for adults, we want almost every adult person in Guyana to receive that vaccine. So when we start rolling it out, we want people to ensure that they get immunized because this is what is going to protect them from COVID-19. Even if you had an infection in the past, you need to still get immunized. And so when we start the program of vaccinating people, we'll really want everybody to come forward to get those vaccines. Of course, when we start getting the vaccines, we will not have for every single person. We'll have to phase it, and we'll be distributing first to our frontline health workers, then other frontline workers, and then, we'll be able to prioritize it. So we have been following the WHO guidelines, and those guidelines are what we're using in terms of allocation. At the global level, they have set up certain principles, and we are following those principles when we start rolling out these vaccines.
Okay. Your opinion, what has been the biggest misconception when it comes to COVID-19 since we started dealing with this since last year?
I think the challenge has been some people don't believe that the disease exists. And if you don't believe the disease exists, then you're not going to comply with it. So in some people's minds, they think it's a hoax. Well, it's not a hoax because, as you know, there are millions of people around the globe that has been infected, and more than 1.5 million people would have died from the disease. So it's a very serious thing, and it's something that we have to really pay attention to. So it's not a hoax, and we got to get people to understand that that this disease is here, and unless we take the precautions for now, and then when we get the vaccine to get immunized, we'll still have a problem.
Right, Mr. Anthony, thank you so much. But before we go, one final question. I realize that the filaria campaign has started, and this is the year that you're looking to exit that aspect of the disease. So could you just give us some brief comments on that?
So filaria is one of the neglected diseases. They have been classified as neglected diseases by the WHO. And we have, for many years now, been working on reducing filaria in Guyana. And when you go back and look at the history of filaria in Guyana, you can look at the work of the Italian doctor that was here, Giglioli, when he first identified some of these cases, and the involvement of mosquitoes and so in the transmission. But outside of that, we have had in more recent times campaigns to try to reduce the level of filaria in Guyana. We have had the introduction of deck salt, where when you buy salt in the supermarket, it had deck that was added to it. And in using the salt in your food and other things that you cook with, that you are actually helping to medicate yourself so that you can prevent the spread of filaria. That program worked very successfully and allowed us to reduce the burden of filaria. But nevertheless, there were still people that still were affected by filaria. In the last 2 years, there has been an additional trust to now work for the total elimination of filaria. Not being satisfied with just reducing it, but trying to get rid of it completely from Guyana. And for us to do so, we had to do what is called mass administration of medication. And that program was started, the tablets were administered, and we had very good coverage. Now, we have a second round that is coming up in February, and once we complete this successfully and we are able to reach at least 70% of the people across the country, then we'll be able to eliminate filaria from Guyana. So it is a team effort here. From the health ministry side, we would be able to provide the medication, get the people to come to your homes to deliver that medication. We'll be running ads to educate people. But ultimately, this public health intervention would not work if when the persons turn up at your gate, you do not accept the medication. So if we want to eliminate filaria, or people know it colloquially as Bigfoot, if you want to eliminate this disease from Guyana, then everybody must take the medication. And if we do so, and we get to that 70% point, then we'll be able to assess, and I'm comfortable that we'll be able to eliminate filaria from Guyana. So we have to work very hard, but I think it's a doable thing, and if we all cooperate with the people who will be coming out, and if we get village leaders and other persons of influence, the religious people in the community, community leaders, if everybody participates and assist us with this program, then surely we would be able to eliminate this disease from Guyana. So with all of the neglected diseases, WHO is very confident that we can come up with strategies to eliminate them. So we don't have to worry about this additional disease. So we are starting with filaria. We are very confident that once we get the cooperation, we can get this one out of the way. And once we get this one out of the way, then we'll turn our attention to the others. So it's a work in progress, and those neglected diseases that we have in Guyana, we have them in our sights for elimination here. And therefore you'll be seeing us after we finish this one, we'll be turning to the next, and hopefully in the next couple of years we can eliminate these things from Guyana.
Thank you so much, Minister Anthony.
Thank you.
Well, that's it for today's COVID-19 update. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.